if we're looking at things like, missing red flags, for example, that's absolutely the case. We are trained to be first contact practitioners. We need to pick up red flags. In my career, I've picked up, aortic aneurysms and DVTs and cancer and all sorts of things. And we do have, a professional obligation to be able to do that, to be able to fulfill that. After that, it comes down to a totally different model of communicating with the patient, which comes back to two things: transparency and agreements. Now, often we don't think about agreements with our patients. Okay, so if they're coming in with the expectation, you'll fix me, and you're there going, I can fix you, and please give me your money, and they don't get fixed, then okay, that could be a reality. But if they're doing something instead, they're giving you a history, you're taking that, you're being quite, honest about what you're going to do, why you are going to do it, and then have their agreement. Does that sound okay with you? We're going to look at this, and then we're going to reevaluate the situation. This is based on my experience and my professional standing. I think this is our best option to begin with. Is that okay with you? You have entered into an agreement with the patient. Okay? If you reevaluate and that isn't the outcome, first of all, we have to check, are you willing to be responsive to that? Yeah, which means that you're not overly attached to that one technique, and you're willing to then entertain that something different may have to happen. That's the first thing. Can you be flexible? So can you see where I'm going here? The communication we have with the patient is the thing that is going to help with the fear about the regulators. If you've gone in with these wow, yes, I'm going to be the great savior, then maybe that could happen. But if you've actually been transparent and you have actually got the patient's agreement that they understand what you've told them, they understand that there's some, uncertainty in there because each person has biological differences, and they have agreed to looking at that course of treatment, then you have an agreement. Now, I'm not saying it's foolproof, but I think you can possibly imagine that if you've had that dialogue and you're checking in with somebody to say, right, this is where, we're going at the moment, we might have to make a change of direction. Is that okay with you? Again, you've had agreement. Yeah? Yes. If you've done a couple of treatments and you feel we're going in the right direction, it's not quite there, again, we are transparent with the patient. This is what I feel. Is that okay with you? Yeah. So how often do people not do that? Because they're taking all of this responsibility, feeling an enormous amount of pressure. And it's performance pressure, and is the patient going to be happy? Well, at any point, you can check in with that patient about that because you've been transparent.